So millennium in Latin means resilience, which hopefully will make a little more sense as I begin this presentation. When I was a medical student rotating at the Veterans Administration Psychiatric Clinic, otherwise known as the VA, one day I had a patient sitting across from me, and he was crying. And the psychiatrist asked him, "Can you tell us your story such that we can help you?" And he turns and he looks over at me, the medical student, and he says, "He's too young. He's not ready." Then he pauses, and he starts telling his story of the experiences on the battlefield that went from memories to nightmares, and now they're waking him up in the middle of the night with his heart pounding, sweating, and he doesn't know where he is, and he doesn't know where he's going. This is more than just him losing his ability to get sleep at night. Now he's having problems in terms of being able to communicate with his friends and family, let alone hold a job. And he's not alone. There's 1.6 million veterans that have either PTSD or depression, and the culmination of this can lead to suicide. In our youngest population of 18 to 24, we've seen a 4 times risk. And worst of all is they're having trouble getting access to the care that they need. Over 185,000 patients are waiting over 30 days to get to their appointments at the Veterans Administration. And this cost, due to the inefficiencies of the system, is over $4 billion. So veterans want to reintegrate to society and have been looking past the 8 to 5 desk jobs into what ways they can get back to working without having the confines of this normal work schedule. And so Michael from the Army said that I'm a war vet with PTSD, and driving for Lyft has me starting to talk more to people. It also keeps me calm since I have riders I have to keep safe, like the role I had in the Army. And so there are more Michaels out there, and there are more of the patients I spoke of, where they're strong people, and they've done a lot to serve us in our country. But now they need our help, and how can we best serve them to reintegrate into society and kind of provide them the ability to extend what the VA is right now not necessarily able to offer. And so that's where we present Millennium, which is a mental wellness health coach platform where we want to empower resilience to optimize treatment and ultimately personalize care. So to empower resilience, we really need to understand what the resilience of these veterans is. And so we're going to look at both the mind and the body. And so our platform comprises of a mobile application as well as a fitness band. With the mobile application, we're going to have a voice-controlled user experience that will allow people to talk to the application. We'll be able to better tell what their mood is. Are they taking their medications? Are they having any side effects from these medications? More so, it's not just what they say, but it's how they say it. There's been research done here, which I think was mentioned earlier in the conference, that looked at the differences in how vowels are said and how that can correlate with depression. Furthermore, we want to better understand not just what's going on in the minds, but how that's affecting their physiological state. So if you're having a panic attack, how is your heart rate changing? How is your sleep changing? Is your exercise changing? All in the grand scheme of your diagnosis in PTSD and depression. Through better understanding this resilience, we're hoping to optimize treatment. And we're going to be able to look at their daily activities and schedule daily breathing exercises, as well as look at their pharmacological treatment and better understand what medications and how the side effects are doing. We also want to stay true to plugging them into their appointments and then having this timeline aspect that's going to help us really aggregate all of this information that we're collecting. So let me walk you through a case example to better understand how this technology is working. So if we have a patient that's recently diagnosed with PTSD, they're going to still go to the Veterans Administration and they're going to see their provider. Once they see their provider, they're going to get prescribed the normal things that they would get prescribed, the evidence-based treatments. And this is going to comprise of not just pharmacological treatments, but also resilience exercises or breathing exercises and certain schedules and routines they can do on to help empower themselves. And so we're going to take the schedule that they're already getting and map it onto our application. And so, for example, at the end of driving at a Lyft day, we could prompt them, do you want to begin cool-down exercise? And we can make sure that that's happening at a scheduled basis. But what makes Millennium unique is we're not just taking this prescription that's static from the provider, but we're making it dynamic. And we're taking all of that data I discussed earlier from the mobile application and the fitness trackers, and we're mapping it on to understanding where the veteran is then and every single second. So for example, in looking at the bigger picture, you might have noticed through the application that there's been a decrease in sleep, they've been doing less exercise, and now all of a sudden the heart rate is pounding at 150 and we have tachycardia. Perhaps this patient is undergoing a panic attack. And we can then have the application intervene, ask the patient if they would like to do one of the approved resilience exercises to help kind of calm down and cope in this moment. And ultimately, we're trying to deliver personalized care. And so we want to plan this data-driven care, looking at all the data points that we have from the person's resilience in every moment and being able to have a better conversation with their provider. So that way it's not you come to your next appointment and your last appointment was a month ago and you're asking, how are you feeling? Are you tired? Did you take your medications? Are you able to sleep at night? But we're able to have a more informed decision in terms of asking those same questions, but being able to have the patient say, I had this panic attack. Oh, let me show you. It was on Tuesday. I did these interventions. I took the medication here, and this is still the results I have. What can we do to improve further? So we can have a better discussion going forward on how to really personalize care for these veterans. And even if they're not able to get an appointment as fast as they would like, they're not going to be left alone. And that's why we're going to be able to manage their appointments and ultimately still leverage all of the other services the VA has to offer. VA has amazing services in terms of like group trainings and community events, and that's why we have this Discover community function, to really make sure that they get plugged in with other veterans and they know that they're not alone. And so RAND did a study and they found that if we were able to treat all of these patients with PTSD and depression just to the evidence-based level, so the standard of care, we would save over $1,000 per patient. When we map this onto all of the different patients that have PTSD and depression that are veterans, we're talking about a $1.7 billion in savings. And so Lyft Health actually told me that I didn't have my Lyft driver numbers updated. But there's about 1 million drivers right now. And so we're going to be able to leverage this ability to better understand how to be able to help these people drive as well as integrate into society. And so for the team, my name is Martin. I'm an MD MBA candidate here at USC, and I've been doing some digital health programs both in Guatemala and Cambodia. Sarah here has been working on the design aspects, and she's in the Ivy and Young Academy and has done a lot of work with Cancer-Based and Peter Kuhn's lab in better understanding how patients cope with the side effects of their medications. And we're extremely thankful for Dr. Krasinova, who's from the VA and a psychiatrist, and is very proactive in understanding and promoting this mental wellness for all of our patients who have PTSD and depression. Ultimately, Meridian wants to serve to help patients have this better mental wellness that we're all able to enjoy. It's not about optimizing the veterans to be able to drive more or more often, but it's to allow them to have a better quality of life and to do so without costing the Veterans Administration more money.
Once again, let's thank these innovators and these tremendous winners of last night's competition.